yes. I have immense pleasure in introducing the next speaker before the final panel discussion, Dr. Suresh Shenvi. You know, his looks and his age belie his experience and his proficiency. Suresh Shenvi is a faculty in endodontics at the VK Institute of Dental Sciences, KLE University, Belgaum. He has qualified for both US NBDE and Dubai qualifying exam to practice. He has contributed along with Gauri Shankar. You know, Gauri Shankar is a name every intern would know because that is a book they would study to take their exams, qualifying exams for post-graduation. So Suresh Shenvi also has helped Gauri Shankar to compile the book called Dentist. He has a YouTube channel, Aspire 32, and he is a KOL for Oricam. But most importantly, why I love this topic is, if at all we leave behind anything for the next generation, it is this knowledge of how to apply and to know what awaits them beyond the shores of our country. Dr. Suresh Shenvi, the floor is all yours. Thank you.
Thank you, sir. Thank you for the warm welcome to the event today. And I would like to first share the screen and make sure that everything is working all right.
Yes.
I hope, yeah. So shall I go ahead with, sir?
Please, please.
Yeah. Warm welcome to everyone. And it is indeed a pleasure to be on this event. And during the COVID situation, sharing this platform with all the colleagues and the young budding dentist to which the dentistry belongs is something amazing. And although I'm not sure whether I should consider myself young or maybe I'm somewhere transiting from a young to an experienced dentist, but I do remember and carry my days of confusion of my student days, and that has led to me to gain an experience, and I have experienced so many exams which during my days of dentistry, and I still learn. And today I'm here to share the same thing, and I've been doing it from many years, and I do update the presentation depending on the current guidelines. And as sir informed, and this is very important topic for everyone because there is very limited information for the young dentist if they plan to go abroad, and that's what I'm going to share today. I want to thank the Femdent and even the Oricam for inviting me on this platform. And of course, you know, who doesn't remember the days of finishing the final year BDS exam and entering the internship. And that day we realized that we have achieved so much. And of course, you know, for your mom also, you know, it's a very proud moment. But unfortunately, you know, as someone has rightly said, that success is a journey, and the graph of that happiness will reduce over a period of time. That's why this can clearly help to understand that it is important to have a goal in your life at every stage, no matter whether you're practicing or whether you are in academics. So some goal is very important for your progress, your work satisfaction. And I'm sure that, you know, this picture what I have put on the presentation depicts everyone's life, and everyone does enter this phase that they start thinking that, you know, what new I should do in my life to excel more. And even I had such dreams which led to, you know, me trying so many exams, and that's what I'm going to share today. And in this presentation, due to lack of time, I will be covering everything briefly, but I'll be speaking more on the Canada and the US examination. And if you have any questions regarding Middle East, you can feel free to ask me in the Q&A section. Of course, you know, India, USA, there is a lot of difference. You know, when you think about dentistry, there are some positive sides in India and there are some positive sides in United States or any other country. So we are proud to practice dentistry in India, but this picture sometimes makes us disappointed that when you hear the charges in United States for dentistry and we consider the charges in dentistry in India, we feel disappointed. But that's a wrong comparison. But this is a funny way to picturize that situation. Most of the time, the students have two options when they are internship, because there is a abundant amount of knowledge which is, and the information is available online, or your colleagues are there, that is your MDS and DDS. I'm not here to tell you whether you should do a post graduation in dentistry in India or you should go for a DDS in United States. I'm here to just present the information. Nobody knows their destiny, and God has plans for everyone. Of course, the recent confusion what everybody has, that whether they should go for USA or Canada, because US, because of the visa issues, people are looking for Canada because the migration is much easier. And that's the reason that students are more towards the dentistry in Canada. And the immigration to Canada is much easier than United States. And if you're young, then it is better because you get a scoring based on your degree, your English, and so many other factors which can help you to get a PR in Canada, which is very difficult to get in United States. But in Canada, you can be lucky to get it at earlier stage. And Canada has additional benefits that if you have a PR, then it does take care of your health expenses and your kids expenses till certain period of age. And so all those benefits are there, and it is much easier to get the PR, and it has been open for immigrants. Of course, that is subject to change. But if you plan to practice dentistry in Canada, then the application is quite similar to United States, except that if you have a PR, then things becomes much easier. And that is more beneficial if you are planning for a DDS in Canada, because the loan which you have to pay for the dentistry to do a DDS will be drastic. That interest are drastically reduced. Even I heard that the fees are also less if you have a PR. The other way, which is most sorted by most of the practitioners, is getting a licensure exam. So one way is you can go, and do the dental degree, and for that you can either appear for the NDEB exam, or the application process, which is very important for both the routes, or you can also appear for NBD United States. And you, in few colleges in Canada, they also accept the admission based on US exam clearance. If you are experienced and dentist, and because I am sure the FEMDENT many practitioners may have joined this session, and most of them do have experience, and they can go into this licensure exam and get a practice license, and that is conducted by 4 exams. You have to clear 4 exams, and in that you will have 2 theory, 1 clinical exam, and the last one is much simpler one, that is the board exam, which is there in United States also, the board exam one. But it is the third exam which is generally considered to be a bit difficult than the first and the second one. Of course, everybody should know that how much is the expense in Canada. According to my friends who have cleared this exam, although the exam fees may be around 6 to 7 lakh, but the process, since it is not as open as the exams in United States, most of them join the coaching, and the materials for exam also has to be carried by you. So on an average, people have told me that they have to spend 15 to 20 lakh in Canada to get a licensure exam, considering all the expenses. Now, the good thing is that if you have a PR, you can work simultaneously, and you have an option of doing some other dental degree like dental radiology, which few of my students have done. And based on that, professional life, you can earn, which is not possible in the United States, because in United States, if you want to work, you have to have a student visa. And if your student visa is over, then you have to get a H1B visa. Only then you can appear, do a job, which is, the system is changing and maybe sometimes difficult to get. But what is the real problem in Canada? Canada is not meant for everyone because most of the time the weather is extremely cold, and it is only few months that you will be happy. And because most of the people feel that the weather, cold weather, especially for Indians, they feel it depressing. But considering the dentistry, and if you are okay with all these weather aspects, then you should try for Canada. And of course, everything in foreign countries takes time. And of course, the real question is why dentist in United States, and why even today people prefer United States compared to Canada, because the earning is definitely better in US than the Canada. And you can see that, of course, probably in India, and considering all the other country, it is only in India we feel that dentistry may be secondary. But we have so many other countries where the dentists are highly paid, and of course the awareness in dentistry is increasing in India too. But in United States, dentists are considered to be one of the, dentistry is considered one of the best area to practice. So let us discuss the procedure to apply dentistry in United States, and all these steps are very important, and that's what we're going to learn today. Of course, the authority what conducts the exam in United States is the JCDNE, that is Joint Commission of National Dental Examination. Now, except Minnesota, most of the places you cannot practice dentistry. There is no licensure exam in United States. You have to do either a residency, that is AGED or general practice residency, or you have to do a program called as the advanced standing program, which is basically a 2-year course, and the DDS is a 4-year course. For international students who have already finished dentistry abroad, the course is reduced to 2 years. And since it is a special course which is meant for international students, the competition doesn't happen with the people who are already there in United States with their citizenship. Of course, the fees is very high for dentistry, and but that is the way. And you can also do residency programs, but the fees is maybe 30 to 40 lakh rupees. And unfortunately, there is no scholarship for the all these programs for international students if you want to do programs related to dentistry. And of course, it all starts the procedure to apply the course in dentistry starts with application of DentP. And if you want to do DDS, you have to first apply for dentin, and it's quite similar to the Aadhaar pin number what we have in India. So all the procedure which is, you will be, all this application process will be linked to this centralized number. And then you have to start with EC application, book the exam date, book the flight ticket. Of course, you need to have a visa. And DenPin is very similar. As I told, it is very similar to any a generalized universal number, which you have to apply from going to this site, which is mentioned. And once you fill that, your details, make sure that the name and all matches what you have on your your certificates, because you cannot change it very often. Then comes the next step, is the ECV evaluation. Now, what is this? See, we all know that dentistry here, the scoring is different. But in foreign countries, especially in United States, it's a it depends on their grading. So this evaluation is basically converting Indian score into the scores which can related to the foreign, the US scores. And for that, you have to send your document. You have to apply for a course by course evaluation. Like you have to send the 12th, 10th, you have to send your BDS marks card, attempt certificate, degree certificate, internship complete certificate. All these has to be sent. And there is a way you have to send it. You can either send your original certificate, or you have to send them, the attested copies from a sealed envelope. And there is a way to send it, which will not be able to cover due to short amount of time. But you have to follow the proper way to send it. Once you send them, you before sending, there is an online form which you have to fill, and you get a letter which has to be printed, and that is sent with these documents to this evaluation. And the fees here for this evaluation is $160, so that is almost 10,000 rupees, and they do give you three extra documents, and it keeps changing, and recently they have modified it. Earlier the validity of this evaluation was 10 years, but now it is reduced to 5 years. So if you are not sure that when you are appearing for exams, please do not apply for EC, because all these things have validity, and again getting them is a big procedure because you have to send the document. It takes some time. So the procedure is, you have to go to EC, select as an individual, username, password, and send the documents, and make sure that there will be one column which will ask you where the document has to be sent. So before appearing for NBD exam, you have to send a document to JCNDE, a digital copy. After your NBD exam is cleared, you have to send this document to all the colleges, schools which you are applying. So that is done later. But when you are applying for EC here, you have to send one document, a digital document, to JCNDE. So this is how the report looks. This is my report, and they give you the grade average, that is the GPA score. And what happens is, you generally, it is not necessary that if you have scored 60% in India, that doesn't mean your score will be less. Anything about 3 is better, and they have their criteria to decide. So once the JCND gets a document from the EC evaluation, they will send you this letter considering that, okay, you are an international student and your document is verified by the EC. So that confirms that you are an international student, that is a dentist from an international dental school, and they call it as a non-accredited dental school. Okay, and we have to apply in that category. For the NBD is for the people, for these, in fact, people who are in foreign countries, their citizen, they also have to apply for NBDE. But for you to get a DDS, the exam, you have to appear for it. The major change what happened recently is the new format of examination, that is integrated national board dental examination, which I personally feel may be a bit difficult for the transition. Okay, because when NBD was conducted earlier, you had part 1, part 2, which was, which used to give time to the student to practice and to learn. Sometimes people take 1 year to practice or read for this exam. But here, in integrated, you have to appear together. So there is a lot to read, but it is not impossible. It is mostly related to your knowledge and hard work. And trust me, it all ends up, it is basically how much you prepare for the exam. If you are practicing, if you have good knowledge, then that can be really helpful, because most of the INBD questions which I have gone through are mostly clinical related. That means that they will give you clinical cases where you should know how to answer rather than simply mugging it. You have to clinically able to correlate. It is an analytic question, which also is happening in India. Earlier in India, they used to only ask you this one question, which is there in some books. But nowadays, they are more into clinically oriented case-based question also in India. So as far as the latest information, the people who apply till October 31st, they can still apply for NBD Part 1 and Part 2. But after that, you cannot apply for NBDE Part 1, Part 2. You have to apply as the integrated NBD exam. If you appeared for Part 1 now, you have another 4 years, till to 2022 to appear for the Part 2. So once you get the EC, the ADA letter, then you have to go for NBD Part 1 application, which is there on this website. And if it is an integrated one, there is a section called as integrated NBD section, and there you will have the same option. So once you put your, they will ask you your dent pin, which is linked to this EDA number. So you have to have a dent pin number, because without dent pin information, the ADA may not be able to relate your information. So once you do the payment here, okay, you have to do the payment before appearing for exam here, and this will show you as active in a eligibility status. So once you do the payment, and you also get an email mentioning this, you can see in first line it is written your application number. This number is very important, because by using this number, you will book the exam for the NBDE or INBD. The NBD part one, part two, generally used to be around $1,050. That is almost 60, 70 thousand rupees current. Looking at the current amount of dollar, which may fluctuate, and the INBD, which is there now, cost almost similar. That is 900 US dollars, which you can multiply by 75. This is just the examination fee. The examination is conducted by Prometric. Okay, and here you have to go and select your test sponsor, which is ADA, and there you will select. In nowadays you get INBD also in this. So select that, read the instructions. The most important thing which you should know is that the ID requirement. You have to either have a credit card, a passport is must, but you should also have a credit card which should have your name. Okay, and that should match with your application name. So with that only they will allow you. So once you put your number here, that which you received from the email, and you have to select the test center. So before booking the exam date here, you will also have an option to check where your dates are available for exam in which center. So you have to first see that where you want to go and stay. It is better to stay with your relatives because it is very expensive in United States, and converting in Indian currency and foreign US dollars, it is very expensive. So if you have someone with your family, and a test center which is nearby their home is always a better option. So once you do that, you get this email considering, okay, saying that your date is the exam and all is you have got a slot for the examination. So then, of course, visa is always issue. I have seen so many students that their visa is always getting rejected when they say that they are going for exam. But frankly, I feel that many students lie in front of the consular, and they are very smart, that they know that most of the students have a long-term plan in United States. So my advice is, don't lie to them. Of course, the visa process can be handled by you, or you can have an agent. The process is very simple. We'll not discuss in detail here, but you have to fill a form called as 160D, and the visa centers are there in Mumbai, Chennai, at many places, and it will be generally for 2 days. That it will be for biometric scan, and there will be an interview the next day. And if you get the visa, then it will be stamped on your passport. So there are many types of visas. You have to apply for the tourist visa, that is B1, B2 for exam. You don't get student visa if you want to apply for NBDA exams. You can always do a MPH, and on that visa, that is student visa, you can appear for NBDA exam if you are already in United States. But if you are just going for exam, then B1, B2 visa, and it generally varies from 10 to 12,000 rupees for the visa process. And you have to carry proper documents. Most of the time, the visa consular will ask you that who is sponsoring you. If you are married, you have an advantage because they don't reject your visa, because they know that you will come back. If you are educated, if you have more achievements, they don't have an intention of stopping everyone, but you should be truthful to them. And generally they don't like to, they decide your visa in just 1 minute. They already have your information. Okay, they just want to know that how truthful you are. And of course, if you are traveling for another purpose, then you can always give that reason. And don't discuss too much about what you have future, whether you are studying that. You can just say that right now I have only one aim, that I have to appear for exams. Okay, and because nobody knows that whether you will go to for you will get admission or no in future. So just explain them about the examination, and do check whether it is a single entry, multiple entry. Most of the time they give multiple entry, and if you lose your passport, you have to again apply for visa. You cannot you will not they will not give a reprint for the initial visa. So let us go to US, but the problem is you still have to study, and these are the subjects. Earlier part 1 had basic subjects and all these books. No matter whether it is part 1, part 2, I truly believe the dental dex is very beneficial for the beginners. And for NBD part 1, if you are appearing, you should also read the first state, especially the microbiology and pathology, and most of the other subjects are clearly explained. It is important that you understand the topic and not just mug, because they twist the questions and they know whether student will answer such type questions, and they can differentiate based on the difficulty of questions. So most of the time for average student, they do take 6 to 8 months for the examination part 1 and part 2. Revision is very important. NBD part 2 consists of clinical subjects, and here also dental dex is very important, and along with that you have various other books. Patient management here should be read by Mosby, which is really beneficial. And similarly here also, most of the books are small, you can mark the important points what you see. And since the exam is computer based, you may be reading very well, but it is difficult to orient yourself in thinking about how you appear in the exam on computer. So there are some softwares on mobile, on desktop, both can be used, and the cost somewhere is 10,000 rupees. And there are numerous amount of groups which are available on Facebook which can help you to prepare, and most of them post their recent questions which will also appear in your exam. So please make sure that you visit regularly and try to solve those questions which are posted on those books. So questions may be either like, you will have multiple options generally, not restricted like Indian, like you have only 4 options, you may have 5, 6. Very rarely they have more than one answer, but there are questions you may have more than one answer. You may have, first statement is true, second statement is false, various combinations, exceptions are there. And in part 2 examination, which happens for the 2 days, the first day will be like your NBD part 1, but the second day will have clinical based examinations, the case histories. So suppose I have so whenever a patient comes to me, I don't, the students nowadays have only habit of looking at the tooth. They don't talk to the patient, they don't see the x-rays. But here, if you do all those things, these exams are very easy to clear, because here, it is as simple as that patient is come to you, and if you know what to look for based on his chief complaint, it is easier to answer. The only problem is that when you appear for the clinical questions, especially the treatment planning, they have a different treatment plan, and for us in India we may have a different treatment plan. But most of the time, except few cases, the questions are very straightforward, and you should be able to compare the x-ray, the clinical features, see the case history, and then you will have multiple questions over this. Okay, I know it is a bit difficult that I'm going it very fast, but due to lack of time, I would be hurrying up. But if you need any more information, you can always contact me. So these are the extra topics which are added in INBDE. Mostly along with the same topics, they also add more of ethics, which are more in detail, and research methodology, which is very important. And nowadays students are aware about research methodology, and I don't think it would be very difficult to answer. And most of the like are basic information, like which type of article, what is the information in discussion, something like that. And here also you will have similar questions like NBD part 1, part 2. Suppose you have this case on your screen related to this case, they can ask you basic question, they can also ask you clinical question. For example, if the patient here it says 10 years old, what will be the basic question? What is the tooth which is erupted at 10 year, or something related to some milestone, something like that? What will be the clinical question? Okay, clinical question here may be based on an x-ray, OPG. What is CT? You can see here that 3-6 has the restoration. So they will ask you have, since there is no sign history, no clinical signs and symptoms here, maybe it is normal. So you have to read all those things. I also appeared for another exam which happened for the first time in 2016, and few of the dental schools do ask you for this, because NBD, INBD do not have scoring. But for scoring, you have advanced dental admission test. Suppose someone is planning to apply for MS or residency, they may ask you to appear for advanced dental admission test, and advanced dental test is bit difficult compared to the earlier exam because it is more inclined towards research, statistics, ethics, implants, than, and the basics are also asked in depth. Okay, but it is not necessary that you have to have NBDE to appear for ADAT. Both exams can be appeared separately, and these are the topics which are covered in ADAT, but they are in depth. They are in depth. Okay, and especially this data research interpretation, which is bit difficult. And nowadays, when in 2016 when I appeared, it was new, but now you have more information, and it happens for a limited period of time. It doesn't happen every, throughout the year. You have to appear for specific time slots in specific those year, and this is the fees what you have. And of course you have to appear for TOEFL exams because TOEFL exam is mandatory for most of the foreign countries. Although I really don't know how does it matter, because our, the English is quite good in United States, but they do want you to appear. And but there is nothing to get scared in a TOEFL exam. But please remember, it is mostly practice based. That means if you appear for the first time, you may not score a lot. But if you appear continuously, at least 2 times, 3 times, a score above 100 is considered to be very nice. And you should have that before applying for the DDS program in United States. And they have reading, listening, speaking section and writing section. Let me give an example here, that read this line: such impact continues to pose a natural hazard to life. So what is pose here? Pose can be anything, it has various meanings, but here the pose means it is present, it is constantly present in a way to create a natural hazard. So most of the time TOEFL you have difficulty in speaking section because uh, they want you to speak in a very clear format. And for that you have a website called as noteful.com. He has made very good videos, and there is abundant, you have so much information about TOEFL online, even NBDE. If you are preparing for biochemistry and physiology, watch a channel called as Khan Academy. That is, nobody has taught me biochemistry as good as the Khan Academy when I was preparing for my exams when I was in United States. So please watch those videos. The TOEFL fees are also not very high, but if you consider all these fees, it quite add up. Along with the flight tickets, it comes to around 3 to 4 lakh rupees for all the examination. Please note that in United States, your admission doesn't depend on that, whether you have an influence or no. It depends on your CV and the recommendation from the people who are there in United States. Okay, because they don't know how much you achieved in India. For them, what matters is, volunteer service. If you have some authentic awards, if you have some good literature articles in a very good journal with high impact factor, all these things make a lot of difference. And that's why, and nowadays many postgraduates do appear for FDA. With plain BDS, it may be a bit difficult to get into a DDS program in spite of having a good financial support. So for those students, you may have to do a MPH program and then apply for NBDE there so that your CV improves. So CV consists of your research, your work experience. If you are volunteer, if most of us volunteer, but if you have those documentation, you should use them, and publication can be helpful. And my request is that if you go to United States, do a observership there under any clinic, so that it becomes authentic. You have your American experience matters more than your Indian experience if you have two people and both have similar credentials. So they do look for first experience in, your experience in United States, and then your experience in your own country. And then you have to also write SOP, that is statement of purpose, and that is basically your story, that why do you want to do your DDS in United States. You can, and most of them have their own story to tell, but get it written in a very nice way from a person who has who had good English, writing skills. And most of them have professional service which is available, which you can access. And of course, after you clear your NBDE, then if you are applying for residency, which may not require NBDE in some of the colleges, that residency application is processed by PASS. MS residencies all are processed by ADEA PASS application and matching process. And whereas in DDS, that is Advanced Standing Program, that is by a different authority. And if you see that, if you want to get dentistry, then few colleges will ask you for NBDA Part 1, few colleges will ask you for NBD Part 2. But even if it says Part 1, you should apply with Part 2 because your chances of getting the DDS is more. But with the availability of INBDE, I don't think it will make a lot of difference now, because everybody will be applying with the INBDE result. The fees, the total fees of dentistry in United States is more than 1 crore. Most of them, they get a very low interest rate in United States, but this is a concern for most of the students. That's why, even though you may be able to clear the NBD, but if you are not able to secure the loan, then it becomes a bit difficult to get it into these programs. And as I told you, there are residency programs are also available, but don't do a course which is not recognized by dental board of that state. For example, there are many courses which are available, an implant course or any course, but whether you will get a license to practice in United States with that residency is what you have to find out before doing that course. And most of the dental boards say that you have to do a residency, which is different from your DDS program. And this residency costs less, but you can practice general dentistry there, but in a limited state. But you have to do at least 2 years of residency to get recognized dental license. So your dental, the advanced standing program, that is your DDS admission for the international students, is managed by CAPIT, and that is a centralized admission, and that cost around $200 to $300. Then you have to again pay $50 to $100 for each school for application and for the interview. So after doing all those things, they give you an interview call, and then you will get selected. It's a whole year-long process. Sometimes people get this after 2 to 3 years, but everybody can do it. If you're capable of doing it, if you have financial support, you can do it. Because nobody told me, when I was, or I had no vision during that time that I can do all those things. And that's what you should have. You should have a vision of future. Most of us, do not push ourselves because we don't see ourselves 1 year, 2 year down the lane. Okay, so make an effort. And these are all, as mentioned, I'm sure you must have come across all these achievements and my blogs for MDS preparation. I'm also a speaker for MDS preparation, so I hope to contact in future. You may also attend whenever we conduct such program. I also started first group in Facebook for MDS entrance. And all these steps are really scary, whether you think about practicing dentistry in India or in foreign countries. But trust me, it is mostly about whether you hang up there. You have to just hang there for 1 or 2 years till that process ends. And once you are done that, you will start growing in those countries. Okay, even in India, it's the same story. Initially you have a struggle, but if you keep putting hard work, you will end up succeeding. So this is my result. I cleared my NBD Part 1, Part 2 in just 23 days. I also appeared for ADAT. This is a certificate which I got. I also run my Aspire 32 channel, which tries to help you to understand the topics from dentistry in a very simple way. I request you that you should check out the Khan Academy and also possible Aspire 32 YouTube channel. Thank you so much, Kumaraswamy sir, and all the members of the E-Famdent for giving me this opportunity. If you have any questions, you can ask me now, or you can contact me on these details. Thank you, sir.
Thank you. Wonderful, Suresh. Because for the last about 25 years or so, I have been into counseling of youngsters. If you can stop screen share.
Yes, sir.
Thank you. And both at the undergrad level and, like you rightly mentioned, that the moment they finish their internship or the last few weeks of the internship, they start running around, not knowing what to do next. But this is the information that we need to reach out to them. And you
Yeah.
did a splendid
Yes.
job
Yes, sir.
uh, of, restricting to US and Canada. Most of the time, what happens, Dr. Suresh and we, in my experience, they want to know about everything and then they're lost.
Yeah.
But this was so focused and so nice. And I'm sure you have equal information about Australia and Japan and other, but then at other times you can share this
Sure.
information with the
Sure.
youngsters.
Yeah,
But
we'll need more time for it. It's a bit difficult
correct,
to cover everything.
correct.
Yeah.
But fantastic.
Thank you, sir.
Doing
Thank you
this
so much.
at any moment in time. If you need any help from my side, do not hesitate. I would love to be part of this endeavor because
Sure,
we
sir.
need to help the youngsters always.
Sure, sir.
God bless you.
Thank you so
Wonderful.
much.
Thank you so much.
Thank
Thank
you.
you.